Attention Northwest Arkansas businesses and talent seekers. Introducing OnboardNWA.com, your hyperlocal job board crafted for our unique community. Struggling to find the perfect match for your job openings? Onboard NWA simplifies the hiring process, connecting you with the region's top talent through tailored talent matching solutions. Whether you're an employer seeking expertise or a professional looking for your next opportunity, Onboard NWA is here for you. Discover more at onboardnwa.com. And let's build the future of Northwest Arkansas together.
It's time for another episode of I Am Northwest Arkansas, the podcast covering the intersection of business, culture, entrepreneurship, and life in general here in the Ozarks. Whether you are considering a move to this area or trying to learn more about the place you call home, we've got something special for you. Without further ado, here's our fearless host, Randy Wilburn.
Hey folks, and welcome to another episode of I Am Northwest Arkansas. This is a special episode that I decided to do because I got an email from a very avid listener, somebody that's relocating here to work with one of what I call the big three. I don't want to name the company, but you can figure out that would either be Tyson, J.B. Hunt, or Walmart. But they sent me a really interesting letter with some concerns about how COVID-19, and more specifically this new Delta variant, is being handled in Northwest Arkansas and just in Arkansas in general, right? I think we all have been watching the news lately, and we've all seen all the problems that are coming up that this new variant is posing for people because we've kind of let our guard down in some ways. But I decided, you know what? I can't talk about this because I'm not a medical professional, but I know people that know medical professionals. So shout out to people like State Representative Denise Garner, to Meredith Lowry from Wright Lindsay Jennings, and to some others for recommending me to my two guests that are coming on the podcast, and that is Dr. Marti Sharkey and Dr. Gary Berner. And I wanted to welcome you guys to I Am Northwest Arkansas. How are you guys doing?
Very good. Thank you for having us.
Absolutely. So, Dr. Sharkey, why don't I start with you ladies first?
Doing well.
Good. Thank you, sir, for coming on. Absolutely. Dr. Sharkey, I want to start with you. Why don't you just kind of tell your superhero origin story real quick, and then we're going to get into this, and then we'll let Dr. Berner give his quick sharing of who he is, and then we'll get into it.
So my name is Dr. Marti Sharkey, and I am the Fayetteville City Health Officer. I have a background. I'm trained as a pediatrician. Went to Vanderbilt Medical School, did my residency training at Johns Hopkins, and then studied for my master's in public health at Emory University in Atlanta. And my background has been in vaccine research and infectious diseases. I always kind of thought that we're moving on a little bit from that. Public health has been more centered on behavior change, and honestly not something I am passionate about. Infectious diseases is my gig, and vaccines. So I kind of had this little niche, and when the pandemic started happening, I started tracking what was happening in Northwest Arkansas and in Fayetteville, realizing nobody was following the data day to day in our jumping cases. So I was one of the first ones to sound alarm bells last May when we started seeing an increase here in Northwest Arkansas. At the same time, the Fayetteville City Council reinstituted the Board of Health, which Dr. Berner is a member of, and then asked me to serve as City Health Officer.
Okay. And Dr. Berner, you want to introduce yourself real quick?
Yeah, I'm Gary Berner, hero origins. I guess I was bitten by a spider about 10 years old. And but instead of being a superhuman strength, I think it was socially awkward and ungraceful. But otherwise, Gary Berner, originally from Russellville, Arkansas, went to Hendrix College and then on to UAMS for medical school and residency. I completed a dual residency there for internal medicine and pediatrics. In 2016, moved to Northwest Arkansas and started working for a community clinic. We're a federally qualified health center, or a community health center, which is able to see all patients regardless of insurance status or income, just hoping to be a safety net for Northwest Arkansas. Then in January 2019, I took over there as the chief medical officer. And so I still mostly do primary care, mostly pediatrics, but do full scope primary care in our Fayetteville clinic, and then have a lot of kind of other administrative roles and duties as well. I think I got pulled into this conversation early in the pandemic, as our particular population, a large population the community clinic serves, was severely impacted by the pandemic, sometimes having positivity rates, testing up at 40 and 50% positive for COVID, even when the nation was at the highest, and Arkansas was the highest, sometimes 15 and 20%. We were sometimes double, even triple those numbers. So I think being a primary care and chief medical officer for that clinic is kind of what pulled me into that conversation. And then when the Fayetteville Board of Health was developed, they reached out to me to see if I would join and hopefully could be a voice for much of the population that we see. We see a very rural population and a large minority population with, don't hold me to this, but I believe somewhere between 50 and 60% of our patients speaking a language other than English in their home, serving a large, serving as a large provider for the Hispanic and martial population in Northwest Arkansas.
Yeah. And those are two of the biggest populations here of non-English speaking individuals that are here, and I know that they have struggled mightily with COVID-19 for sure. So yeah, it's certainly been a challenge. I think it's so multifactorial. There's certainly not just one thing, but it has certainly been a very significant challenge for that population. Yeah. Well, I wanted to, and Dr. Sharkey, maybe you might want to answer this. Can we talk about the state of where we currently are right now in terms of this COVID-19 variant that we're seeing, that we're calling the Delta variant? And why should people be kind of alarmed or concerned in that this is much more than just another strain of COVID, that it's something to really take seriously?
So you mentioned, let me unpack that. So there's so much to that question, so many factors. So where we are in Northwest Arkansas, first of all, we have to address our vaccination status. In Northwest Arkansas, in Washington and Benton counties, what we are seeing is relatively high vaccination rates within our cities. So within Fayetteville, Springdale, Rogers, and Bentonville, our vaccination rates for at least one dose are well over 60% now. You go over one zip code, that drops down. You go over two zip codes, it drops down a lot. So the more rural you go in our counties, the lower the vaccination rates. So that's kind of where we are in our counties at the moment. We can address why that is with a subsequent question. The Delta variant is significantly more contagious than the original Wuhan strain, at least 3 to 5 times more contagious. The original Wuhan strain had an R0, or reproduction factor, of a little bit over 2. So that meant every person that got infected tended to infect 2 other people. That's without masks, without vaccines, without any public health measures. With the Delta variant, that reproduction number, that R0, is 5.8. So every person that's infected without any measures in place is going to infect 5 to 6 other people.
Wow.
That's a significant change. We were already worried about how infectious Delta or COVID was at the beginning. Now it's COVID on steroids. We are seeing people with this variant show up more acutely ill and deteriorate, is our medical term for it, more quickly. Fortunately, we've learned a lot. So our mortality rates they're picking up because we have more cases, but it does not seem to be more fatal. We've gotten better managing it as healthcare workers. Why should we be worried? The Delta variant took hold like lightning just north of us in Joplin and Springfield, Missouri. They, like us, in their city centers had higher vaccination rates, but a very rural surrounding area with low vaccination rates. This past weekend in Springfield, they had 240 COVID inpatients in 2 hospitals. At the height of where we were last winter in January, we had 135 to 140 COVID inpatients in our 3 hospitals, and we're a much larger population center. So that is why we should be scared. We are worried right now that this virus, and we've seen it when it travels, it goes along transportation routes. It follows interstates. It's going to come down I-49. We're already seeing it. It's also going up I-49 to Kansas City. So we are seeing what was happening in Springfield and Joplin a few weeks ago start occurring here. Our hospitals are getting full with COVID. We are also, as different from last winter, last winter, all we were really dealing with was COVID. Now we are seeing other viruses, other illnesses. We are seeing people sick with delayed care. So our hospitals are full with non-COVID, and now we're adding COVID on top of that. In addition, we've been trying to help out our neighbors to the north. So we've been accepting some of their cases as well. So it is putting a strain on our frontline healthcare workers. And these men and women are already exhausted. They are mentally exhausted. They are emotionally exhausted. And they were not mentally prepared to gear back up at this point in time. That's where we are. And I think that that's a warning bell, not just for Northwest Arkansas. The rest of the country has this same situation. Population centers are well vaccinated. The more rural areas are not.
Yeah, and Dr. Berner, I definitely want you to weigh in on that. I guess my simple thought before I let you share your thoughts about what Dr. Sharkey just said was that this idea that when people are in more rural areas that they stay there, but people don't stay there. Like somebody could be out in Goshen or somewhere out just a couple of zip codes from where I am here in Fayetteville and ride into the city center of Fayetteville and then go back home. And if they have COVID, they're bringing it with them. It's like luggage. We carry it around with us. It's not like we can just leave it at home and run to the store or whatever. And I think that's the point that people are missing. And I have, it's interesting because I've been participating with Theater Squared's event, which, it's quite interesting that they've been able to do this production of Matilda at the Fayetteville Public Library, and they've been very responsible about how they handle it. But I just can't help but think about, just how COVID is actually traveling around and the importance of masks. I mean, I stopped wearing masks for a while, but then I just put them back on recently, and I don't know that I'm going to take them off anytime soon, and I'm fully vaccinated. So I just think people need to be mindful of that. And that seems to be the problem that we have right now, is that people are, as we're entitled to here in the United States, expressing our freedoms, but that comes with a price. Dr. Berner, do you want to add anything to what Dr. Sharkey said?
Yeah, I think that's very fair that we want to have freedoms, but we also need to take responsibility for our neighbors. And almost this whole pandemic has been, I think, an example of service and servanthood to your neighbor. Masks have not been about yourself. The vaccine is about yourself, but very, very important for myself. it's more about my parents, it's more about some of my older family members, even than it is for myself. And it's about my patients, even more so than it is for myself. So, yes, you want to be able to express your individual liberties and choose for yourself. But in a sense, it's about being, been in the deepest, longest dirt road of the Ozarks and have a flat tire, or had, a canoe rack break, and it doesn't take 5 minutes and somebody's there helping you out. This is that same type of friendliness. This is that same type of service that someone's going to be so willing to stop off. They don't know me from Adam, but they'd be willing to help me out with whatever issue I'm having way back in the boonies of the Ozarks, the areas that I love. And this is really that same thought process, about, kind of service to your neighbors. I think Dr. Sharkey captured it very in terms of the status of being very concerned about the Delta variant, and the details of where we're at in Northwest Arkansas. I think taking it a step further, we know about the direct effect of the Delta variant. And then we just started to open up to, as healthcare workers, we're already burnt out. We've already been missing time, missing vacations, long hours, and mentally, many of us are having some PTSD, seeing these numbers go back up and knowing what's to come. Absolutely feeling those effects. We have already seen, not even just from a healthcare worker, but the mental health impact of what the pandemic's told. Suicide and overdose rates have been at all-time highs. Just a repeated article I saw yesterday that 2020 set the record for overdose deaths. The isolation, the loss of our activities and what we enjoy, being secluded from family members and friends, all of that has had severe mental health impacts, and that's on our healthcare workers, and that's on our community. Our psychiatrists and counselors in our clinic have had more high acuity patients, more need to transfer for hospitalizations for acute inpatient stay, more patients with suicidal thoughts than ever before. So we have, just as another huge reason to really take control of this pandemic, take control of this virus, is like Dr. Sharkey has shared in its direct respiratory effects and ventilators and hospitalization rates. And then again, just on our own mental health and the indirect deadly toll that's having.
Yeah. It's so, I've been reading, it's so hard because I think people, just the average layperson like myself, you get so much information. You get it in the news, you get it through podcasts like these, you get it by reading, or maybe you don't read, I don't know. But the bottom line is there's so much, we're inundated with so much conflicting information. And what would you recommend to the listeners here? What would you recommend to people to kind of stay in tune with so they have a clear understanding about what's going on? Because we do know that certain news outlets are skewing the data, that certain news outlets are actually just misinforming what is reality with this disease, with this illness. So what would you recommend to the average person that's listening to this and is kind of fed up, honestly, with all this different noise coming from all different directions, and they don't really know what to believe?
So my recommendation would be listen to your local health officials. This virus acts locally, so we need to be on top of what is happening in our community, and we need to get accurate information that is not being influenced by any political agenda. And like I said, unfortunately, some media outlets skew the information one way or the other. We've seen that. It's not all just right wing. It's left wing too, that we can see it skewed. So we need to be listening to voices that do not have a political agenda, because this virus does not have a political agenda.
Yeah.
Yeah, I'd echo that as well. Maybe you're not someone that regularly needs to see your doctor, but this is a perfect reason to go set up and talk with a physician or establish with a primary care provider, nurse practitioner, to really have a chance to discuss, is this vaccine right for you? Most folks listening to this will not know me or Dr. Sharkey, but they do have a family practice provider that their uncle has seen or that their mother has seen for years. So, whether that's Dr. Clay at Mana or Dr. Carter at Mercy, or talk to a pediatrician. Maybe your family has gone to seeing Dr. Allen at Community Clinic in Rogers for decades, potentially. Conversation with one of those people that you know and trust, that can really know your own history and your family's history to hear if it's safe and effective for you. Because the overwhelming information is saying, yes, it is, that it's doing a really good job of protecting you. But again, I don't expect anyone to know and trust me. But I can guarantee if you've seen Dr. Allen for years, that he's the type of person that you would trust, or one of the great physicians with any of our other, primary care clinics. Those are going to be some great people to talk to. Even if you're 25 with no, medical problems, this is a perfect reason to set up that visit, and take that time to really have a conversation. Be proactive, not reactive. I've just seen some heartbreaking reports as Children's Hospital has gone up in their ICU numbers. There's just been some heartbreaking news stories of families that are now highly advocating for the vaccine. Don't wait for that. Don't be reactive. Have a proactive conversation about whether this is right for you, right for your children to 12 right now, and right for your family.
Yeah.
I would add on to that, one population that we're missing that Dr. Berner referred to is the young adults. Once they leave their pediatrician, like me, they're pretty healthy for a while. They usually don't establish with a primary caregiver until they're 40 or 50 years old or something occurs to them. So those people we don't interact with as a medical community routinely. So if you're in that category and you want to go back and talk to your pediatrician that gave you all your childhood immunizations, we will talk to you. Every physician in Northwest Arkansas is open to discussing this with any patient that they've ever taken care of and the ones that they haven't, and the parents. I'm discussing with my parents why they should get vaccinated in my clinic. That's not my normal role as a pediatrician to jump in on the parents' healthcare, but I am.
Yeah,
Randy, often. Oh, sorry. Go ahead.
No, what were you going to say? Please.
Oh, same for Dr. Sharkey. Often, I may be having a 6-month-old well check. But for me, the value of that visit is typically, what are the developmental milestones, weight gain, grams per day, what's the children's, how many vaccines have we got? I'm now often spending over 50% of those times talking with the families about, have the grandmothers, have the caretakers from this baby been vaccinated? What are your concerns about it? Because that's more important than those other details for that visit that day. That's what's most acutely dangerous to that baby, is how well is that baby protected by having the family vaccinated. So I'm sometimes spending as much time talking with the families, talking with the grandparents that are coming in, the caretakers for that baby, and focus on the baby in that particular visit.
Yeah. So, obviously we're not going to solve everything on this podcast today, although I wish that I had that magical power. But the bottom line is, I got
bit by the wrong spider.
I know it's all good. It's all good. But as we embark, we're just a couple of weeks away from August. We know what August means, at least in the South. Here in Arkansas is back to school. The U of A is coming back full tilt, is what I understand. What do you see coming down the line? And I'm not asking you to necessarily mete out what you think, what policy is going to be, but what do you think is going to be the best practice moving forward, especially as we open schools back up? My kids start back on the 4th. I think the U of A starts the 3rd week in August. So, we're going to have an influx of people coming to Fayetteville, coming to Northwest Arkansas as a whole, people that have been all over the country, all over the world for that matter, and they're going to be back here in this little hamlet that we call home here in the Ozarks. So, what are your thoughts about that, and what are some of your recommendations going to be moving forward, at least for the next few months, as we try to get this, if there is such a thing as getting this Delta variant under control?
First and foremost, is if you're not vaccinated and you're eligible, go have those conversations. We need to all lovingly encourage our neighbors to get vaccinated. And then we also need to model mask wearing in situations where it's necessary. So those children under 12 that are not eligible, we need to be doing everything in our power to encourage them to wear masks back to school. We have seen that not occur at camps and vacation Bible schools this summer. So we need to see if we can change that narrative. As I'm sure listeners on here know, we cannot mandate that as a city or as a public school system. That power has been stripped. The spider took that power away from us.
Yeah.
So we need to be getting that message out. Get vaccinated, wear a mask.
Okay. Dr. Berner?
I'd echo those same thoughts. And I like the way that Dr. Sharkey phrased it. We need to, I think, lovingly encourage that conversation and lovingly encourage vaccinations. I'm a big believer that school suspensions don't work. And I think the same context here. This is not about browbeating or judgment. That is not going to lead anyone to getting a vaccine. This is about having a chance to have a conversation and understanding why the vaccine is right for you or it's not right for you. And so it's kind of proactively having that conversation. You ask what's to come. Probably like a 57% optimist. And so I really hope that these conversations happen, that we can get the vaccine out, that we can get our students in the schools to wear masks, and that we can take back up some of the social distancing that we were so ingrained 6 months ago to really get this under control. I'm really concerned about the impact of the Delta variant if we don't.
Okay. I am too, honestly. And my biggest concern really is just, I've had to stop telling people or asking people if they've gotten the vaccine, because after a while, you walk around and you don't want to be like, you don't want to make it a scarlet letter type thing. You just want it to just be like, hey, it's something that you have. But I know for a while there, I was just, hey, I've gotten vaccinated. How about you? And I realized that was creating some social stigmas there. And I don't want to do that, because I'm not, like you said, I don't want to browbeat people, but at the same time, I mean, we have to be, if I will take an old maxim, I mean, we are our brother and our sister's keeper. And I think we have to do a good job of that, but figure out the way to do it without necessarily throwing anybody under the bus or making them feel bad in the process.
Yeah. The vaccine is widely available. We are working on getting it even more widely available, reaching those spots that haven't had that opportunity yet, reaching out to churches, reaching out to sporting events, reaching out to, various get-togethers to really, increase that opportunity. Hopefully we can make sure that everyone has had that chance. Everyone has had that opportunity.
Yeah, sure. And Dr. Sharkey, you want to add anything to that?
Yes, I'd like to add that Dr. Berner's clinic, we started off this conversation with concerns about how we were handling the Delta variant. We are handling the Delta variant as well as anywhere else. It just happens to be that it's here before it's other places. But for instance, Dr. Berner's clinic has had a mobile clinic out in front of the DMV. If there's a place that we're going to catch everybody, it's the DMV. So we really are exercising our ability and stretching it to get everywhere and be accessible for the vaccine in all sorts of places. We've been churches, farmers markets, food banks, town halls, parking lots. It's not that it has not been available. And sometimes people hear this narrative, well, rural America, it's an accessibility issue. And that is not the case here in Northwest Arkansas. Our healthcare workers have done an admirable job and continue to roll out this vaccine and make it available. At this point, it's about having those conversations.
Yeah, I think and again, it's those conversations that you're going to have with your neighbors, some family members. I've had to have conversations with family members, which isn't always easy, but I think if at the end of the day, the individual that you're speaking to understands that your only concern is their health, right? Their ability to wake up the next day and be able to breathe the air that you're breathing, that I think speaks volumes. And I want to encourage everybody to be, especially those of you that have been vaccinated, to have those conversations early and often with family members, with loved ones, with friends, associates, anybody that you come in contact with, and figure out a way that you can just encourage them to do that and be a part of what the solution that we're seeking here to overcome this pandemic. Because I don't know about you guys, you specifically, and I know both of you are tired. I'm just tired of the pandemic, but I can't let my guard down, because if I do, I am susceptible to actually, having to deal with COVID in a way that I don't want to have to deal with it in my family, from, being in the hospital or dealing with it from that perspective.
Yeah, we're very proud of our efforts. I think the healthcare community in Northwest Arkansas has been incredibly resilient, from your hospital and ICU workers to our primary care clinics and pediatricians, getting the information out and keeping folks out of the hospital. The vaccination efforts have been, really supported by the Northwest Arkansas Council, and that's coming from organization and conversations from our major healthcare entities. Conversations that have never happened before in Northwest Arkansas, but just great coordination between those groups like we've never seen before. And then, financial support from some of those really big industries in Northwest Arkansas as well, to get just huge numbers of vaccine available in Northwest Arkansas. So have those conferences take the opportunity, get this Delta variant quieted down.
Yeah. Any final thoughts, Dr. Sharkey?
I thought, you mentioned the big three at the beginning of this podcast as well, and the support from Tyson, JB Hunt, and Walmart. And I would put a special star next to JB Hunt. He's gone out of their way to support the vaccination efforts here in Northwest Arkansas. Has been amazing. Our healthcare systems have come together that are used to be competitors are on the phone with each other hourly right now. And if you have a conversation with a loved one and it doesn't go the way that you want, just know that you may have moved the needle a little bit. And then when Dr. Berner or myself or another physician has that conversation with them, it'll help us get them there. So every little bit helps. So don't get discouraged.
Yeah. I've always been reminded that truth comes to all of us in our own time, right? And so we each get there. We some of us may get there a little later than others, but we all get to that truth at some point. So I think that's the encouragement. Dr. Sharkey, Dr. Berner, I just want to thank you guys so much for taking time out of your schedule last minute to come on this special episode of the I Am Northwest Arkansas podcast. And again, we didn't want to dumb it down, but we also didn't want to get too highly technical. And you guys were perfect with sharing just kind of an anecdotal perspective of what's going on right now, what we need to be thinking about as we move into the end of the summer and early fall here in Northwest Arkansas and beyond when it comes to dealing with COVID-19 and some of the variants that we're seeing, like this Delta variant. So thank you guys so much for coming on the podcast.
Great for having the conversation. Dr. Sharkey is good at the technical and making it sound intelligent, and I take the dumb it down role.
I wasn't calling anybody dumb, but you know what I'm saying. So no, I appreciate that. I appreciate that. I appreciate you guys. And I hope anybody listening to this will take the time to share it with a loved one, share it with a friend, a family member, somebody that's on the fence. And hopefully some of the words and encouragement that you heard from Dr. Sharkey and Dr. Berner will be able to kind of push you over the edge. And maybe they'll see you in one of their clinics getting a vaccination shot and maybe bringing some other people with you to do the same, so that we can put a lid on this and hopefully get back to some normalcy before the end of this year.
Absolutely.
Thank you.
Take
guys.
care. Hope to meet you in person sometime.
Absolutely. That we'll make sure that happens. So thank you.
Thank you, Randy.
Thank you guys for listening to this episode. We appreciate you tuning in to I Am Northwest Arkansas. Remember, our episodes come out every Monday, but then we also have special episodes like this, especially when we're dealing with things like COVID-19. So I appreciate you guys taking a listen. Please share it with a friend. Remember, sharing is caring. I'm your host, Randy Wilburn, and I will see you soon. Peace.
We hope you enjoyed this episode of I Am Northwest Arkansas. Check us out each and every week, available anywhere that great podcasts can be found. For show notes or more information on becoming a guest, visit IamNorthwestArkansas.com. We'll see you next week on I Am Northwest Arkansas.